What is asthma? Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to breathing difficulties. It can cause recurring episodes of wheezing, shortness of breath, chest tightness, and coughing. While asthma cannot be cured, it can be effectively managed with proper treatment and lifestyle adjustments. Causes of asthma. The exact cause of asthma is not fully understood, but it is believed to result from a combination of genetic, environmental, and lifestyle factors. 1. Genetics. A family history of asthma, allergies, or other atopic conditions increases the risk. 2. Environmental triggers. Exposure to allergens like pollen, dust mites, mold, pet dander, or cockroach droppings. Air pollution or irritants like smoke, fumes, or strong odors. 3. Infections. Respiratory infections, especially in early childhood, can influence asthma development. 4. Lifestyle factors. Obesity, stress, and a sedentary lifestyle may increase susceptibility. 5. Occupational triggers. Exposure to chemicals, dust, or other irritants in the workplace. Triggers for asthma symptoms. Certain factors can provoke or worsen asthma symptoms, including allergens, pollen, mold, or animal dander. Irritants, tobacco smoke, strong smells, or air pollution. Weather changes, cold air, or sudden temperature shifts. Exercise, physical activity, especially in cold or dry air. Infections, respiratory infections like colds or flu. Stress and emotions, anxiety or intense emotions can tighten airways. Medications, certain drugs, such as aspirin or beta blockers. Symptoms of asthma. Symptoms vary in frequency and severity, but typically include 1. Mild symptoms. Wheezing, a whistling sound while breathing. Coughing, especially at night or early morning. Mild shortness of breath. 2. Moderate to severe symptoms. Difficulty breathing, chest tightness or pain. Increased mucus production. Rapid or labored breathing. 3. Asthma attack, exacerbation, severe difficulty breathing. Cyanosis, bluish lips or face due to lack of oxygen. Inability to speak in full sentences. Requires immediate medical attention. Diagnosis of asthma. Asthma is diagnosed through a combination of medical history, physical exams, and tests. 1. Medical history. Family history of asthma or allergies. Symptom patterns, e.g., triggers, frequency. 2. Physical examination. Listening for wheezing or other abnormal lung sounds. 3. Pulmonary function tests. Spirometry. Measures lung function by assessing airflow and lung capacity. Peak flow meter. Measures how fast air is exhaled. 4. Allergy testing. Identifies potential allergens triggering asthma. 5. Challenge test. Controlled exposure to specific triggers, e.g., exercise or irritants, under medical supervision. Types of asthma. 1. Allergic asthma, triggered by allergens like pollen or pet dander. 2. Non-allergic asthma, triggered by factors like stress, infections, or irritants. 3. Exercise-induced bronchoconstriction, EIB, symptoms occur during or after exercise. 4. Occupational asthma, triggered by workplace exposures. 5. Childhood asthma, asthma that begins in childhood, often associated with allergies. Treatment of asthma. Asthma treatment focuses on controlling symptoms, preventing attacks, and improving quality of life. It typically includes 1. Medications. Quick relief, rescue medications. Short-acting beta-agonists SABAs, such as albuterol, to relieve acute symptoms. Long-term control medications. Inhaled corticosteroids, ICS, reduce inflammation in the airways. Long-acting beta-agonists, LABAs, used with ICS for long-term symptom control. Leukotriene modifiers, help reduce airway inflammation and prevent attacks. Biologic therapies, for severe asthma, targeting specific immune pathways. 2. Lifestyle changes. Avoid triggers, e.g., allergens, smoke. Maintain a healthy weight. Manage stress through relaxation techniques. 3. Asthma action plan. A personalized plan developed with a healthcare provider to monitor and manage symptoms. Includes guidance on medication use, identifying triggers, and responding to worsening symptoms. 4. Allergy treatments. Allergy medications or immunotherapy allergy shots to reduce sensitivity to allergens. Complications of uncontrolled asthma. If not managed, asthma can lead to frequent hospitalizations due to severe attacks, chronic airway remodeling, permanent narrowing of airways, reduced ability to engage in physical activities, increased risk of respiratory infections. Prevention and management. 1. Preventive measures. Regular use of long-term medications as prescribed. Annual flu vaccine and pneumococcal vaccine to prevent infections. Identify and minimize exposure to triggers. 2. Monitoring symptoms. Regular use of a peak flow meter to track lung function. Early identification of worsening symptoms to prevent attacks. 3. Healthy lifestyle. Regular exercise to improve lung function under medical guidance. Balanced diet rich in anti-inflammatory foods like fruits and vegetables. Asthma is a manageable condition when properly treated. Early diagnosis, consistent care, and active management can help individuals with asthma lead healthy, active lives.